As a part of your protocol, your doctor has prescribed Pergoveris. Pergoveris is a medication that you'll keep in the fridge, and it comes in multi-dose boxes. There's a 300 unit box, a 450 unit box, and a 900 unit box. When it's time to do your injection, you'll open the box and take the pen out. You'll notice that there are many needle tips in the box, many more than you'll need. But that's okay, you'll just use what you need and then you can discard the rest when the pen is done. You'll take a needle tip out of the box and you'll take the lid off of the pen. Inside the pen is the medication. It's this clear fluid at the top. It's already mixed and ready to go. You'll notice that there's numbers on the side of the pen here that indicate how much medication is there. You don't need to pay too much attention to these numbers because we're going to measure it in another way, which I'll show you. The first time that you use it, you'll just take the lid off, as I did, and you'll take the paper off the end of the needle tip and twist it on to the top of the pen until it's nice and snug. When you take this white cap off, there's still a green sheath covering the needle. Then you'll look in this window and dial it up to whatever dose you've been instructed to take. So if your dose, for example, is 150, you'll turn it up to the 150 dose here. If you go past by accident, get a bit excited, no worries, just turn it back down to the dose that you've been instructed to take. In this case, let's say 150. Now your medication is ready to inject. You'll take the cap off and the green sheath off, and you're ready to inject the medication. When you go to inject this medication, you want to make sure that the numbers are facing up when you inject it so you can see them as you're performing the injection. Once you've injected the needle into your skin, you'll make sure that your finger goes to the middle of the flower on the end of the syringe here, and then you'll push down right in the middle of this flower, looking at the number in the window until you see that number go all the way down to 0. Then you'll pull the needle out of your skin and then let go of the end of the pen. Now you'll take the needle tip off of this pen, put it in your biohazard bag, put the lid back on the pen, and put it back in the box and store it in the refrigerator. The next time you go to do this injection, it's almost the same, except when you take the lid off the pen before you put your needle tip on, make sure that you use an alcohol swab to clean the top of the pen and then apply a new needle tip to the top for your next injection. In the next part of this video, we'll go over how to landmark and inject your Pergoveris subcutaneously. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.